Hi, welcome to Your Health Matters OC. Another episode, and tonight's episode is actually very important, is about opioid and fentanyl misuse and overdose prevention. So if you have any question, please send us an email as yourhealthmatters@ochca.com. Again, that email for you to send us question is yourhealthmatters@ochca.com. But before we talk to our guest, let's go to Dr. CK, my co-host, for a COVID update.
Yes, good evening, everyone. Thank you for tuning in tonight. We do have an exciting topic, and we have great guests here to talk about that. But I do want to focus in on COVID, as we always do. Unfortunately, I have bad news today. Our numbers are unfortunately increasing. So we have now, as of last week, we had 170 cases that were hospitalized with COVID and 26 who were in the ICU, which actually is an increase from the previous weeks. And our adjusted case rate also increased from 4.9% the previous week up to 5.5% last week. And our case positivity is also rising. It went from 6.1% to 6.5%. And unfortunately, we're not alone. Other surrounding counties are also seeing a slight rise in their case counts as well as their hospitalizations. And also Northern California is experiencing a rise in cases. So it's really important for everybody to remember that, unfortunately, COVID is in our communities, and we all need to take precaution to really reduce our risk of getting severe illness. And that means getting the updated COVID vaccine. Unfortunately, we still see that not many people are taking up the bivalent vaccine, and it's one of the best ways to prevent a severe illness because it provides you the variant the instructions to help your body produce immunoglobulins or antibodies against the more current Omicron variants that are circulating in our community currently. And it also has the previous COVID original variant that we were all exposed to early on. So again, if you haven't gotten your bivalent vaccine, please go get it. It's available in many pharmacies, your local providers' offices. It's still free of charge, and it really can help reduce the risk of a severe illness. Those who were vaccinated, actually, in a recent study, those who were vaccinated were shown to have 14 times less likely to die compared with those who received no vaccine at all. And then they were 3 times less likely to die compared to someone who received the original COVID vaccine and not the updated vaccine. So again, please get your updated COVID vaccines. Anyone 6 months or up who has completed their primary series, and it's been 2 months since their previous dose, is actually eligible for the bivalent vaccine. So please get that. And if you do think that you were exposed or you have symptoms, please get tested. There's many tests that are still available. There are free tests that are also available. So if that's the challenge, there's the federal government is still delivering free tests to homes. And there's also a website to help get free tests. We also here at the county have some free tests. And schools also have access to free tests, so get tested. And if you actually come down with COVID, there is treatment. So the most common treatment that is still effective against the most common variant that's circulating is Paxlovid. And that's more widely available. It's available to anyone 12 and up who has higher risk of illness. And higher risk can actually just mean being physically inactive or being obese. And we know that obesity is a huge issue. You can have a history of asthma, you can have diabetes, some chronic conditions that one wouldn't think would lead to severe illness, but that actually qualifies you. If you're 50 and above and you don't have any other risk factors, that's already a risk, and you would also qualify. Additionally, if you're not up to date with your vaccines, that also qualifies you. So again, there's a large range of people who actually qualify for the oral treatment, and the oral treatment can really reduce the severity of symptoms, get you back on track, and can reduce the viral load on your body and reduce potentially long COVID, and that's also what we want to prevent. So please get treatment. And for those who have a weakened immune system, and that means, again, anyone who is a 50 or above, or maybe you're undergoing some other treatments that deplete your immune system, you really want to take precautions. So that means getting vaccinated, improving the ventilation, and spend time outdoors when at all possible. Learn about locations where you can get tested and where you can get treatment if you do get sick. And then Of course, get tested if you come down with symptoms. Continue to follow the precautions, preventive measures, such as washing your hands frequently. I still use hand sanitizer because I think it's great. And if you are sick or someone around you is sick, hopefully they're also following respiratory precautions, meaning wearing a mask or coughing into an elbow so they're not spreading their germs with you. And wearing a well-fitted N95 mask still works. It provides a barrier between you and someone else who may be carrying the illness. I still wear my mask, especially when I'm indoors, outdoors. I consider myself higher risk, and so I just don't want to be down and out with an illness, and I think this has definitely protected me, so I'm hoping more people will do that too.
And I wear a mask because you are high risk, and we interact with each other day in and day out at work, so precaution to protect you, that's why I wear a mask.
Thank you. I appreciate it.
And then when I go to the supermarket, I wear a mask because I don't know people indoor at the supermarket whether or not they are protected, they get vaccinated or not, so I wear a mask. I want to go back to the getting the antigen test. You can get it in two ways, right? You can order it through covid.gov. That's the website that the federal government can send free antigen tests to your home.
Right.
But the second way would be if you have insurance, including Medi-Cal, you can walk up to a pharmacy, give them your insurance information, and you are entitled to 8 antigen tests per month. And for those of you, because of your job requirement or what have you, and you need more than 8 tests a month, you can have your family physician write a prescription for more tests, and you can get it for free. But the initial 8 tests a month is free without physician insurance. You have to do is just show your insurance card to the pharmacy and you can get it, right? So I would recommend you to do so, because I hear story of people have to pay out of pocket, and I say, but why? You have private insurance or you have Medi-Cal, you can get it for free. You don't have to pay it out of pocket. So very important to stock up, because if you have symptoms, it will be readily available at your home. You can test it, right?
Correct.
And so that's the key message is if you have a symptom, stay home, test yourself, talk to your primary care physician to make sure that you don't have COVID. And so it's so easy now. It should be part of our life routine. So hopefully you get enough messages from us to do so. Right. Any other update?
That was the update I have for COVID. The good news about flu and RSV is that those numbers have gone down,
right.
So that's not as much of an issue. I think we still need to focus on COVID.
Great. So let's talk to our guest tonight, Miss Glenda Aguilar, who is a manager for the healthcare agency, Mental Health and Recovery Services. And then our special guest, Mr. Matthew Kozlov, who is a person in recovery, and you're going to share more of your story. And I'm so grateful for the courage for you to come and talk to us about your experience. So I'm so excited. Again, for those of you who are watching at home, if you have any question for our guest speaker tonight, you can send me an email to yourhealthmatters@ochca.com. Okay, so Glenda, Ms. Aguilar, our subject matter expert in terms of treatment, give us some statistic as related to opioids and what people need to know.
Sure. I think one of the things that we really wanted to get out tonight is just fentanyl is something that you find everywhere now. It's a very potent opioid, and it's 100 times more potent than morphine and 50 times stronger than heroin. I think people need to hear those numbers, and it's potent.
Say that again.
It's 100 times.
100 times.
Yes.
More potent than morphine.
Yep. And 50 times stronger
than heroin. And then the other message I hear from you is people actually don't know what they are buying on the street, right? Whether or not it is laced with fentanyl, we don't know. Is that correct?
Yeah, that's correct. It can be found in any of the substances.
Yeah. And sometimes the middle person, the one who are selling the drug, don't even know themselves, do they?
A lot of times they're not even out to get fentanyl, right? And they're looking for something else.
Yeah.
And
that's important information. Thank you.
Yeah.
So continue on.
Okay. And just a couple of things that we wanted to highlight tonight is just that Orange County is seeing large increases in substance use related deaths in the last few years during the pandemic. There were at least 1,358 substance related deaths in OC in 2021. And the number and the rate deaths just keep increasing. And they've steadily increased over time. There were mainly significant increases in 2020 and 2021. The death rate increased by 32% from 2019 to 2020, and another 30% increase from 2020 to 2021. And again, the increase was largely related to fentanyl.
Wow.
And again, like you mentioned, people don't know that that's what's in the drug that they're buying.
Yeah.
So,
Do you know the age distributions of who die from fentanyl?
I think that's in the data that we have, but one of the things that I really just want to point out tonight is for ages 10 to 17-year-olds, there was an 800% increase in substance use related deaths from 2019 to 2020.
800%.
800%, and then another 112% increase 2020 to 2021. So it's huge, and it's not stopping either.
Yeah, that is sad. What? Talk a bit about the prevention piece, right? Naloxone, otherwise known as Narcan, right?
Yeah.
How can people access it, etc.? Who should get it, etc.?
Right. One of the things, I mean, anyone and everyone should be able to access it, and it's available out in the community. I know for Orange County itself, we're going out in the communities and conducting forum events, providing education piece on naloxone overdose prevention, along with how to use it, so that when people are walking away from these events, not only they're picking up a kit from us, but they're also learning how to use it in the event that there's an overdose. And so a lot of our outpatient county mental health and substance use disorder clinics also distribute them to all of the patients that come in who may have a need for that, whether it's for themselves or for their family members. We have distributed over, I believe, 2,000 naloxone in the events that we've had, and we've had about just 8. So it's a small number since we started this in August of last year. So there's definitely ways of picking up a naloxone or Narcan. You can even go to your pharmacies. I know that there are 2 pharmacies that are participating, and that's Rite Aid and CVS. So even if you walk in there without a prescription, you can go in there and show. They do charge your insurance, and so showing your insurance will allow the pharmacist to hand over they become your prescriber to naloxone, and you can then have access to
So
that.
kind of similar to the antigen test. For Narcan, you can walk into a pharmacy with your insurance. Now, private insurance, there might be a copay, depends on your private insurance. But for people with Medi-Cal, it's actually free, no cost. And the pharmacist will teach you on how to use it. I think before the show, we were just talking, and Matthew, you made a great point. By the way, we'll get to Matthew in a minute. But you made a great point, and that is when you get it, you should read on how to use it, right? And not wait until you have to use it and then open the box and then, have to read the description, even though the pharmacist will teach you. But some people don't remember, right, when you're getting it. And then the other thing we would recommend that every single parent with young children should get it, right? Because there will be, I'll tell you, my sister who's watching, well, why would I go on to get Narcan? I said, because you don't know. You really don't know, right? You might save a life, might not be your kids, but their friends, right? And so have it available with you at all times. I think most physicians who are prescribing pain medication like morphine and opioid are should be prescribing Narcan with them,
prescription.
right? But I don't know how many physicians actually doing that. So if you have a loved one on pain medicine like this, I would get it and have it as handy because you never know, right?
Yeah, and that's what we've heard too from folks who have gotten prescriptions, and they have shared that they do get a prescription as well for Narcan for them to take home and have in the event.
Yeah, and so if you go into the pharmacy for Narcan, there's no need for a prescription from anyone. You can get it like that. We're fortunate to have a courageous young man who joined us tonight as our guest speaker, Matthew. So Matthew, share a little bit about yourself, what you're doing, who you are, why you're interested in this topic.
Well, first of all, thank you for having me. I was pretty excited to come down when I was asked to share on, my experience. I currently live out here in Orange County. I grew up here, and I went through a whole experience through addiction and trial and error, and it led me to where I am now. So, it was a positive outcome, but there was a lot of struggle that took place in between that to get here. And there's many times where, people thought, and even I thought, that I wouldn't make it to this point. So, I think opioid addiction and fentanyl addiction is a very, important topic.
So I'm so grateful that you're doing well in recovery. How long have you had now sobriety?
I have just about 1 year and 4 months sober. Yes, clean and sober.
Fantastic. Yeah, for us, that's important. Do you mind share with us, when did your journey start?
So my journey started coming out of elementary school. At 12, I started messing around with pot and alcohol, and it quickly progressed. Right off the bat, I said, let's try everything, and that turned into a lot of headache for everybody and myself. So I started with that. I moved into pills, and quickly, once the pills were no longer available, I found other people that can get me the other things, and it led over to heroin and then eventually fentanyl.
Wow. So how did you get into the fentanyl thing? I mean, what happened? Is that by accident? Somebody introduced you to fentanyl? What happened there?
Yeah, actually somebody did introduce me to fentanyl.
Okay.
He wasn't giving me cut drugs. We were just going right for the street fentanyl, which was very powerful.
Okay.
Yeah.
And so Glenda talked about how fentanyl is 50 times more potent than heroin. And that's the number that people toss around and been shown around. Is that true? I mean, is that potent?
From my experience, yes. It is roughly 50 to 100 times stronger than heroin. And at this point now, you're not going to find heroin without fentanyl in it.
Wow.
It's pretty diluted. It's pretty diluted out there, and it's everywhere. So
All right.
it's unfortunate.
So what turned the corner for you?
Man, there were many corners I had to turn. I had a lot of trial and error, and I thought I can do things my way, and my way led me into places I didn't want to be.
Okay.
And so I was taken into, a court system that had a really strong healthcare agency tied into it that focused on addiction. And, they gave you the resources. We had, a lot of things I did not want to do at first, like, healthcare meetings and group meetings and one-on-one therapy sessions. But it turned out that's where you can really break into, and divulge into like the problems and what's causing it and what you can do and where the resources are.
Okay. So from age 12 till about a year and a half ago, by the way, he said he's 27. I still don't believe it. You look so young. So that 15 years span,
roughly, yeah.
Right? How many programs would you say you've been completed or not completed, different program, outpatient, inpatient? How many programs? Do you remember?
I've started and or not completed 11 programs.
11 programs.
Yes.
In 15 years.
Yes. It was a
Wow.
ride.
Wow. So the last program you mentioned is the county-run, is that a court program?
No, actually, the last program I went to was a private insurance-covered program that I'm familiar with, been there before.
Okay.
But getting the courage to get in there, wasn't something I would have known if it wasn't for the resources that was provided while in, the Orange County Healthcare Agency's programs.
So talk about that program, and maybe, Glenda, you can expand a little bit about the program that Matthew participated in, right? So the program name?
Oh, it was, so I participated in drug court.
Okay.
Which is county run for, different regions of Orange County.
Okay.
And they pulled me out of jail and brought me in there.
Okay.
And at that point, I didn't know how to hold a job.
Okay.
I didn't know how to make it to an appointment on time.
Okay.
None of that.
Okay.
And I still kind of fought the system a little bit, but in due time, I was, working consistently and learning how to show up on time to my meetings and show up on time for myself, take care of my health and my mental health. And so the program gave you all those resources. Okay. All you had to do was ask for it.
Yeah. So you graduated from drug court.
Correct.
And then you decided to go and extend your treatment in a private side.
Correct.
Okay. Tell us a little bit about drug court and who could get in drug court and how do people get into drug court?
Sure, drug court's a little different in that just how Matt had shared, Matthew, sorry, now I'm shortening his name since we've been sitting here, the last half hour here. It is a drug court, like you have to be referred by the court, you have to be either coming out of jail or you are going to be going to jail, and so instead of serving the time in the jail, they allow you to then go into a program to get into your recovery and start your recovery at that point. We do have other services available in the county that's not necessarily referred by the court or by the jail system. It is something that it's outpatient or residential services that we do have where you can walk in at any of our outpatient clinics, substance use disorder clinics, and ask for help. As you mentioned, that's probably one of the most important things that you can do for yourself, right, when you're going through that, is asking that help that you need. And so
it's voluntary, right? You
it's
have
voluntary.
to volunteer to want it. Even in drug court, you have to volunteer to want it. If the judge ordered you to go into drug court and you said no, then you just
serve your
finish
time.
out your
Yep.
Yep.
Okay.
Yep.
How do people get information about all this treatment program at the county?
I think the easiest way tonight is, turning the people to go to OC Links. It's our 24/7, 365 days. It's available, and we have the phone number available. If it's not showing on your screen, it is 855-625-4657. But it is available for you 24/7, like I mentioned, and there's opportunities for them too, if you're calling during the day, during business hours, to where you can get connected to one of the clinics that would best suit your the services you're looking for.
So how would a youngster, get into fentanyl? God, you might have been a target by those drug dealer or what have you, right? Because for you to be so young and get into heavy duty opiate like that, what happened? Do you remember?
It was kind of just by choice. It was, I wasn't really shown a way once I had started at such a young age.
Okay.
I didn't really have any resources around me to show you that, this is where you can go for help.
Okay.
It helped kind of seem like something you didn't want to get because you were afraid to divulge into it with anybody because there's a fear of repercussions. So it was intimidating.
Okay.
So instead, continue trying to, strong arm it and eventually you come back to it if you don't have the right resources.
I'm going to show the second video that talk about the fentanyl crisis, but I want to prep our audience and prep you. When we come back, we're going to talk about the adults created program and messages for prevention, right? But did the message really truly get to a youngster? Like when you were 12, 15 years ago, there was messages all over the places, right? But how come that message didn't get to you? Okay, so let's talk about that. So let's take a look. The next video is called "One Pill Can Kill." It talks about the fentanyl crisis. So let's go.
You've heard about pills killing young people, right? A teenager takes what they thought was a prescription pill and never wakes up. We're not talking about a drug overdose, accidental or otherwise. We're talking about being fatally poisoned by a single pill, one that looks like a legit Xanax or Percocet or Oxycontin. Except these pills aren't legit. They're counterfeit, fake. They can kill you within minutes. And it's happening all around you. The fastest growing group of victims is young and inexperienced. They take pills for different reasons. Some of them are experimenting, others are stressed out and self-medicating. Many victims died at home in their beds after swallowing just one pill. Every young person is at risk. So what's going on? We live in a quick fix, pill-popping culture, and we've been taught to trust prescription pills. In some cases, these medications are necessary, but they can also cause addiction. That's why we're in the midst of an opioid epidemic. So many people in the US became addicted to opioids that drug dealers started making fake pills to meet demand. The active ingredient of choice for these counterfeit pills? Fentanyl, a powerful synthetic opioid that's so potent it has to be highly regulated. There's no standard amount of fentanyl in these illegally made pills. They're not prescription medications. They're just thrown together in people's basements and garages with other cheap ingredients like filler powder, impressed into pill form. The dosage is never even. That's why they're so deadly. But fentanyl can be cheaply imported, and it's also highly addictive, which makes it ideal for creating fake pills. The drug cartels got involved too. They started to produce these counterfeit prescription pills containing fentanyl, known as fentapills, on a massive scale, flooding the US with millions of fakes dressed up to look like the real thing. You can't tell them apart. Authorities can't fix this or make it go away, but you don't have to be the next victim. If you don't know where your pills are coming from, don't take them. Don't believe sellers on Instagram, Snapchat, TikTok, or any app. Don't believe friends who get pills from supposedly reliable dealers. Don't believe someone who says a pill has been tested. You may have heard of test strips that can detect fentanyl in illegally made drugs, but they're not reliable with pills, where fentanyl can be unevenly distributed. There's no way to figure out whether a pill contains fentanyl without grinding it up and dissolving it. In other words, destroying it. So if a drug comes to you in pill form, it hasn't been tested, period. And even if you test one pill in a batch, you have no way of knowing whether the other pills contain fentanyl. If it's not from a doctor or pharmacist, it's not legit. No random pills. Now you know the facts. Tell your friends, tell everyone you know. The more people who learn about fentanyls, the safer we're all going to be. You didn't create this problem, but you can be part of the solution. Help us spread the word. One pill can kill.
Hi, thank you for watching I think, one of the most important shows that we've had so far. You've learned about the fentanyl crisis, and you are talking to experts both on the professional side as well as somebody with lived experience. So Matthew, thank you so much for being here with us. Let me ask Dr. CK and Glenda, from a professional, because you both mental health professional, physician, and both have teenagers, especially teenagers' son. How do you deal with this at home? Do you talk to your sons about this? Doc?
Yes, I do. And actually, I was concerned even from when my kids were really young, because already as a physician, I was already seeing exactly 12-year-olds saying that they had easy access to any medication and any drug they wanted. Cents, and sometimes even free. So they didn't even need money. They can easily access this. And I actually was telling my husband, this was years ago, and my son was just entering kindergarten, right? And I was saying, oh my goodness, I'm so fearful for our kids when they grow up, when they get 12, 13, 14, that they're going to be exposed because it's already here. And it's something a lot of parents don't talk about, that it's easily accessible. And a lot of schools, even at that time, didn't want to talk about how easily accessible it was. So I already started talking to my kids, even from a young age, to ask, hey, do you know about drugs? Do you talk to your friends? Like, can you talk to me? Keep that open door. But I have to admit, they keep things away from me. I'm a parent, and I know that. I even took my son I wanted him to attend the event on Narcan, and he had other events to go to, but I brought home a box of Narcan. I told him, I want you to carry this in your backpack. But he was also in denial, saying, Mom, my friend's not doing it. Like, why do I need to carry it? And so, again, there's this denial that it's around, but obviously it is around. Every school has access, even elementaries across Orange County. I don't care which southern, northern, central, it's everywhere.
And do you talk to your young patients on this topic? I assume that.
So in the military, we talked about it. It was a more structured. It's the base, so we can instantly, get a hold of things and put the active duty member on notice if anyone finds out about anything. So it was more regulated. But when I got into practice as an outpatient physician in Southern Orange County, almost immediately I found out about it because I was asking some of the questions in an indirect way to some of my patients to say, hey, have you been experimenting? Yeah. And it takes time for a child to finally open up to you, but several children opened up to me to say yes. It's available. Yeah. I can try this medication. I've tried. They can even get access to what they think is prescription drugs, which we know that now can be laced with fentanyl, right? Yeah. Kids are always, they're under so much pressure nowadays that they're looking for anything to ease the anxiety, the panic, all the pressure that's on them. They want to focus. So there's all types of things that they have access to that they think may help to self-treat, which we know is not the right way, but there's just so much pressure. Yeah.
As someone who's even closer to the field and with teenager son, what's your approach been?
The same, similar to what Dr. CK just mentioned, is really talking to them early on. I still remember my oldest, who's now 17, senior in high school, before she went into middle school, as an 11-year-old, talking to her about what's around the school and what can be there, what she can be offered. And I remember her coming home one day and saying, Mom, that's everywhere at my school, right? Like, we have kids in the bathroom doing this and doing that. And so that really it's scary to think that at that such young age, to where they're young, what do they know about those things? So really a lot of communication, a lot of having them talk to us about what they see at school. Obviously, like you said, we're parents, right? They're not always gonna tell us everything. But I do see over time, I think now that my daughter is much older, 17, she's definitely more open in saying what she sees when she's gone out to some of these parties that, friends hanging out.
So in your outreach to the community and talking to parents, how receptive do you think our parents are to this idea of preventions? Or is it that, oh no, not my kid?
Yeah, so that's still a little bit challenging, I think, in the times that we've gone out in the community. I think a lot of times we hear from just the parents who are attending, who are there, and who would say, oh, some parents won't be here, right? And they'll share. It's because the minute that they do show up, there's a little bit of that acceptance that my kid could potentially be using. Mm-hmm. So I think if they're not showing up to some of these things, then it must not be in their home. Yeah. So,
yeah. So Matthew, we were just talking about how, the adults create messages, prevention messages, and the government create messages. And I remember even 15 years ago, there were messages around drug use and what have you, without name program back then. How were they appropriate for you as a youngster?
For me, I mean, I was just not really receptive to those programs that they put out there. It was just something that, you know, it became more of a fun activity to get out of class. You would join into those.
Okay.
You know, I'm sure there's different ways that can be made to make it more engaging and something that, you know, a message can really be sent over. But there's still work to be done on some of these programs because, you know, the statistics show that some of these kids are not, you know, receptive to it. And, you know, the rates are going up on, you know, deaths. So there are things that can be done to really grab the attention of the kids, bring people closer to their age that have experience, that have gone through it and, you know, are working on recovery. That would really be beneficial to help show them, you know, something more relatable, you know, to learn about the messages right there.
Is it truly a sensitive issue if somebody create a message? How do the messages get to the youngster, right? Does it have to go through the parents, go through the school? What is your opinion?
Well, I think any avenue would be right because everybody, you know, is receptive to everything differently. Right. So it depends on you know what you rather, you know, what's you're more receptive to. So like, say you go to your parents to talk about things a lot, then that would be a good avenue. But to kind of hit them with all angles, you know, bring it to the schools, bring it to the school events, bring them to the families. And you know, there's different advocates out there that could help bring the message to them.
Who were the? I'm going to ask it, Matthew. And if you don't feel comfortable answering, don't answer. Okay, I'm okay. Who were the adults in your life during those years from 12 to at least 18 who were engaging you in this kind of conversation? Whether it be, hey, this is dangerous, or don't do this, or here's the treatment. Who were the adults in your life?
It was my mom and dad. They were really pushed. They obviously kind of knew right off the bat I wasn't great at hiding what I did. So right off the bat, they knew what was up, and they immediately pushed for just sending you off to treatment. That was their first shot. They didn't really give time to, you know, educate me on it or, you know, show me what are other options, or, you know, it was just straight to a treatment center. So that was their plan, and it could work for some. You know, I'm not knocking that, but you know, everybody, you know, it's a very delicate approach because you could really fight it off early on. So it would need to be come with some care.
So obviously, at that age, you were probably hanging around kids your same age that doing the same thing, right? So remember back collectively, what resonate with all of you? What kind of messages resonated with all of you?
Elaborate on that for me.
So let's say if there's a program on, you know, anti-drugs or drug treatment, what messages resonate with all of you? Like, oh, we might want to pay attention to this.
You know, it's a tough one. You know, that's a tough one for me. I would say sometimes the statistics could be something that resonates with me, but, you know, I could only say that, you know, in retrospect now. So the statistics, as well as, you know, more hands-on activities, I guess. It would be harder to really explain that, but even showing kids at an early age how to use the Narcan. You know, I feel like that's something that can kind of like give you a more physical image of like, this is something you would need to do in a situation when somebody is, you know, having an overdose, because that's more like, you know, it feels more real.
So
When did you learn about Narcan? Because obviously you were exposed to all kinds of drugs since the age of 12. What age were you when you finally learned about preventive measures like Narcan or treatment?
So for Narcan, I only heard about it when I was 20. So I had roughly, you know, 8 years or, you know, some 6-8 years of not knowing what that is.
So Matthew said something that kind of clicked in my head, right? Are we training kids on how to apply Narcan?
We have Narcan available for distribution at all of our children and youth behavioral health clinics as well. So that would include helping and teaching, whether it's the kids that are coming in for services or their parents, on how to use it. And so when we've gone out to the events, unfortunately, a lot of the audience that we have are mainly adults. But certainly that sounds like that's a targeted Right.
Do we have plan or are we allowed? Because the distribution, we got it from the state, right?
Yeah.
So there's got to be a set of guideline on who we can distribute the Narcan to.
And we can distribute them
Is
to minors.
children one of the target audience that we could?
Yeah, or
Okay.
adolescents, and yeah.
So
they're
do we
targeted.
have a plan in place that we are only going to invite, adolescents, and then we're going to show them how to use Narcan?
There's
Or is there parents, right? So that we talk about is that information overload, not enough information, not enough appropriate information, or the parent is the barriers. Let's be frank about it.
Yeah.
Right?
So a lot of the schools that we've gone to, we do leave it to the high schools to decide how they also, like when they've invited us, it is up to them to decide how they would want us to, provide the information, whether parents would be there or not. I know when we've partnered with the sheriff's department, like with other sergeants that have gone to the schools, they've gone and visited and they talked to the kids, showed videos. Although there is no Narcan distribution at those events, they showed how this can be available to them. So there's definitely more work to do, is what it's sounding like, in being able to get this life-saving device out in the community, especially in the hands of, adolescents. And
So what if we have a program, an event, where we target the kids, but the parents are also invited, but the target audience would be the youngster, like Matthew talked about, right? Teach them how to use it, because you just heard it from him.
Yeah.
Somebody need to teach the kids on how to use it. It doesn't go through the parents, right?
Right.
Do you think your parents would have an issue?
No.
Okay. I mean, both of you as parents for a teenager, would you have an issue if an event is targeted your son?
I wouldn't have an issue, but I know that this conversation is had amongst a lot of parents where they're concerned, well, I need to know.
Of course.
And then
of course.
there's that denial.
Sure.
This is not happening in my community. No, we're not. You're not going to teach my child how to use that, because that does not apply to my child, right? So I think there's going to be some resistance, and I think this is where it has to be a community effort. So aside from the Orange County Healthcare Agency trying to do this, and even schools, we already know that can be a sensitive area for parents, and so maybe communities. So what do I mean by communities? Like churches, right? It's a common place where families come together. They can actually also access Narcan. They can also request for Narcan distribution from the state and teach their parishioners how to use this. And that might be a better way, or some other community events, because again, it becomes sensitive. I know that even last year, before the emergency statement that was made in the later half of last year, even going to schools and asking to talk about this was a big no-no. A lot of schools were like, no, we don't want to talk about it.
So the Substance Abuse and Mental Health Service Administration has produced a video called You Talk, They Listen. Really encourage parents to have communication with the children. So let's take a look.
Email from school about the incident today.
Scary.
Tell me about it. Did you have any idea that was going on?
None. I mean, you saw Derek at the game last night, too. Did you have a clue?
No, but teachers like me, parents, we don't always know as much as you guys do. Kids hear first about what's going on with other kids.
Half the time, it's rumors.
It can be hard to tell sometimes, but if you're ever concerned about a friend who's having trouble with alcohol, prescription drugs, bullying, violence, anything, you need to tell an adult. Mom or me, a teacher, coach, school counselor, someone you know and trust.
Dad, no kid is gonna tell an adult about that kind of stuff.
I get it, but if we don't know, we can't help. Speaking up about a problem, that's what helping a friend is all about.
Thank you so much. Welcome back to Your Health Matters OC. Again, if you missed the first three segments, this is about opioid fentanyl crisis and prevention. So, Matthew, I heard from you that number one, the information is probably delivered better by children the same age to a youngster the same age to their peers. And secondly, teach the youngster how to use Narcan, right? And then we also hear from Dr. CK and from Glenda on there are some parents who are still resistive to that, right? Perception, oh, my kid is not, whether it be really that they are not aware of what's happening or they're afraid to find out, right? So what would be the right messages? Because you said something, right? I didn't say it, you said it. It's like the messages that we had 15 years ago didn't work, and the current message still don't work because we still have kids dying from fentanyls and what have you. What kind of messages that are appropriate, that are catchy, that are okay for parents to feel comfortable that yes, you can send this, or you can send this messages to my kid, or you can outreach to my kid?
I mean, that's a great question. I think for children at a younger, in their early teens, or just in grade school in general, it would be wise to have somebody roughly their age or a little older helping get the message across. Definitely, it's very important. Yes, you may look up to your parents, but you may not be receptive to conversations that can get uncomfortable.
Because certainly in this conversation circle, somebody is doing a very good job in communicating with the kids, right? The dealer.
No.
They're doing a very good job in keeping our kids addicted, right? I mean, yeah, there's addiction and there's drug craving and all of that, but beside, the message is very clear to entice people to buy drug, right? Did you experiencing that getting drugs, buying drugs, the message is easier than prevention and treatment?
Well, absolutely. Avoiding is so much easier than confronting, to go to a dealer, the conversation is a lot shorter than it would be to talk to your parents or, somebody about your problems.
Okay.
So yeah, maybe there's a way that we could, approach people at a different way, a different angle that may be more just enticing or more, at least, more opening.
I mean, there's a misperception out there that, oh, kid who do drugs, a kid who have problem at family. That is absolutely not true. We have many cases where there's no issue at home, but what's happening in school, in the environment that the child's in, is what get them addicted. I mean, I'm not making an assumption in your case. Is that your case, or cases that you're familiar with?
I mean, yeah, this is very true.
Yeah.
This is exactly how many things get started, yeah.
And help us understand, drugs overall right now, the street drugs are just so addicting, right? So once you even start trying, it's hard to not be addicted. We talked about that's why some fentanyl is being put in a lot of other drugs, because it gives you a little bit more of a high, and it's cheap and easy. And the marijuana that's available now is so much more addicting than the marijuana 10, 20 years ago. So every illicit drug that's out there is just more addicting than it was previously. At least that's what I'm hearing. And I don't know, you can tell us from the experience.
Well, you said something earlier about the stress in school, right? And I can tell you, I have treated plenty of family, children where the pressure is so high that the kid got around to a stimulant, like Adderall, so that they have more hours in the day for them to do homework, to follow up with all of this pressure in school, and then eventually they find themselves to street drug. What was your case? Or do you know of a situation like that?
I'm very familiar with that, yeah. I've seen plenty of kids that went ahead and did that. My experience was a little different, of course, like I said. I seeked the experiences, but it is very common for those, trying to help enhance their performance in whatever they're doing, and then it turns into an addiction, of course.
Yeah. But how do we fix this pressure in school? Because I tell you, I have teenager niece and nephew who are in high school, and the amount of homework that they got, the amount of program that they have to be involved in. I don't remember doing that when I was their age, and it wasn't that long ago. Hopefully, you believe me that it wasn't that long ago. Kids nowadays, just, I mean, even 15 years ago, you were probably facing a lot of stressor, right? Because I know my niece and nephew your age, they were struggling with, oh my God, keeping up with what, volunteers, work, tutoring to just keep up. Was that the school pressures some of the element for you too, Matthew, or no?
Yes, and also family, being at home.
Okay.
You know, it wasn't a very, you know, healthy environment. So I didn't feel the need to be home.
Yeah.
At
So
an early age.
multiple stressor. in your
There's so
case.
many that could, at an early age, there's a multitude of things that are that can cause so much stress. And there's more things stressing you than there are avenues of relief.
Okay. So the message really have to target that. I mean,
Correct.
do you agree?
Yes.
So how do we do that, Ms. Aguilar? How are we going to make sure that we craft messages that hit to the core of what a child, a youngster is facing, right?
I think that's a great question. I think that's the forever $1 million question, right? I think we do need to get to their level to understand how we can best help them. And I mean, the one thing that really stood out for me today and just having Matthew here is really figuring out a way of how to communicate better to a lot of our young kids and knowing their language. You know, a lot of our kids now are into their devices all the time. So, you know, our approach right now is we're going to the school, we're doing all of these, you know, things to help educate. And I wonder what it would be like to change that tactic a little and get them more involved into the things that, you know, Instagram or something like that to help them get the message. So we have a lot of work to do.
Yeah, but I know we as a health agency, we collaborate with the school system, right? With Orange County Department of Education and with the school superintendents in really paying attention to children's wellness, all children's wellness. I say our children's wellness really is about our future leaders' wellness. Like, you know, he's a business manager. Wow. But I'm wondering how many people who experience the kind of life, the journey that Matthew went through and come out on this side and are successful like Matthew, right? I can't even think of the number, but we need to ensure that we have an environment to promote wellness for our children. Do everything we can, right? De-stress, right? Creating well space in school so that kid can check in, doing school hour, talk to a professional, right? And whatever stressor that they are facing at home or in school environment, you know, we haven't even scratched the surface of the level of stressor that they're facing. So maybe that's another show that we come in and talk about what are the actual stressor that children are facing. I mean, you're only 27, so you're only a few years away from the school experience, so maybe we'll bring you back and bring educator back and talk about what are the stressor in school combined and what can we do for our kids, right? But we have 2 minutes left. I'm going to ask you to briefly give us your words of wisdom. What should we do to outreach to youngster?
Like I said, I mentioned before, the best way to outreach to the youngsters would be to have somebody, you know, closer to their age come through and, you know, give the message that way. It's a lot harder to, you know, be receptive of a message, you know, when you're looking at someone you don't necessarily look up to or can relate to.
Sure.
If you can, you know, find some sort of affinity with that person, then you're more receptive to what they have to say.
Sure. And I know our communication director is very good with getting the right messages by asking people like yourself and youngster opinion on what work and what don't work, right? But we still have long way to go in outreach into family and with Matthew recommendation, right? Simple. How do we get access or enticing parents to allow the children come to event to talk about fentanyl, to learn how to use Narcan, right? Of course, the parents who are open to that will come to the event, and the parents who are not will never come. But I think we should at least look at creating program like that targeting the kids and their family, so that it's not just the adults. Because I think we're missing the point if we bypass the kids, right, and just go to the adult, like Matthew talked about. So
Right.
let's plan on that.
Yeah, I mean, the highest
Sounds like-
rise that we saw in the deaths related to opioids were in the adolescent and young adult age
Yeah.
groups. And so we really need to do a targeted response to those
Yeah.
groups.
Matthew, honestly, thank you for the courage to come and talk to us. You will save life. I believe that for the audience out there. So thank you so much. For the
Absolutely.
people who are watching, please spread the news and share this video we have on file on YouTube at OC, Your Health Matters OC. So please spread it. If you have any question for Matthew or Glenda, continue to send us an email at yourhealthmatters@ochca.com, and we'll make sure that they will get to the question and answer you. But we definitely will bring Matthew back to have a conversation on how do we help the school system, engage the school system, and Glenda to come back and maybe give us a report if you do plan on having program for children. We'll see you in 4 weeks on March 21st. We will continue the conversation on March 21st on food insecurity and what are the resources available in the community. So until then, thank you, be well and be safe. Thank you.